This is our anesthesia form that we use during surgery. Here you will list the patient identification, first name, last name, the veterinarian that's responsible for the surgery, the procedure that's going to happen, the diagnosis of the patient, the anesthetic risk, and then over here you have start times and stop times. Start times for the anesthesia and the procedure, stop times for the anesthesia and the procedure. Then you will notice we list the pre-anesthetic drugs that were used, the dose, the initials of the technician that gave the drugs, and the time that it was given. And that is the same for the induction drugs, maintenance drugs, reversal drugs, and the fluids, the pain medicine, and also the antibiotics that were used. And then down here we list the post-anesthetic care, where you would list the temperature before the surgery, during the surgery, and after the surgery. And then down here you have an emergency plan with the drugs and the dose and the route that if there were an emergency that you would give them. And then over here on the left side it's the patient safety checklist. It's kind of good for the technician and the patient. You just check everything that you've done to make sure that you're doing the induction and everything right. And then down here on the bottom we have the technician that's monitoring the surgery. They sign their name and their date. And then on the back here, this is something that we fill out while the surgery is taking place. You record the pulse and the respiration every 5 minutes. And then once again, you record your name and the time that it was done. Over here, and then over here, up here, there's a place for the technician to put their signature and the date. And then up here it gives you examples of how you're to record this on the chart. The pulse, the respiration, blood pressure, and so forth.